Namaste. I am Dr. Amit Mishra, radiologist, perfect imaging. And today we'll talk about a very common condition which every one of us has felt or suffered at least once, or let's say many times in our lives. I'm talking about abdominal pain. So it's a very common condition. We all face abdominal pain on a regular basis. So, what are the important things that you should know about abdominal pain? What are the common diseases, some of the common diseases which can cause abdominal pain? These are the things which I'll be explaining. So, I'll start by telling a very important sentence which you should pay attention to. Please pay attention to this sentence. All abdominal diseases do not cause pain. And on the other hand, all causes of abdominal pain do not mean disease. So, this is a very, in my opinion, a very important sentence that you should understand thoroughly. So, what I said is, all kinds of abdominal pain do not mean a serious disease. There are many abdominal pain which do not mean any serious disease. Let's say if you are having a acid reflux, in which abdominal your stomach acidic contents just reflux uh, proximally, and they cause a discomfort, they cause a retrosternal pain, they cause a pain in your chest, in your upper stomach. This is a very common condition, not very serious, can be easily managed with very common medications. Sometimes there can be bloating, dyspepsia, which you call gas. That is also a very common thing, nothing to worry about. Can be easily managed with some basic medications and lifestyle changes. Similarly, if there is a intestinal colic, means there is some kind of twisting in the bowels, in the intestines during their motion, that can also cause pain. So these are some of the common conditions. Hyperacidity, that can also cause pain. So these are some of the common conditions which do not have any serious outcome, and you do not have to worry about them. So but these all cause pain. So as I said, not all causes of abdominal pain mean a serious disease. And on the other hand, the second part of the sentence, not all abdominal serious diseases have pain. So uh, if you do not have any pain, doesn't mean you do not have any abdominal disease. That is not at all true. So there are many diseases, many serious diseases which will not cause any pain. uh, I've seen many advanced colonic cancers, cancer of the bowel, cancer of the intestines, which have not caused pain until very advanced stage. There are many gallbladder cancers which are detected incidentally on routine ultrasounds and do not cause any pain. There are many kidney stones which do not cause any discomfort, any pain to the patient, and patient comes for a routine ultrasound or for any other ultrasound, and we detect them incidentally, or for any other CT scan and we detect them incidentally. So there are many diseases, serious diseases, which do not cause any symptoms, do not cause any pain. So that's why I said all causes of abdominal pain do not mean a serious disease, and all serious abdominal diseases do not cause pain. So this is an important thing that I wanted to tell you. So something else that I want to tell you is which kind of pain you should specifically be uh, conscious about and take them seriously. So there are some specific kinds of abdominal pain which can point to a certain condition. For example, if the pain is in upper area of your stomach, in the upper part, and it is radiating from front to back, going from front to back, and it is associated with vomiting and the pain is severe, then you have to be uh, conscious about a condition called pancreatitis. Next type of pain, a pain which is radiating from front to back, going from front to back, associated with burning urination, associated with fever occasionally. This kind of pain can be due to ureteric stone. Ureteric stone is a stone in the ureter, which is a tube-like structure which connects kidney to your urinary bladder. So, a ureteric stone, which people commonly call kidney stone. So, these can cause this type of pain, which radiates from front to back, and it is quite severe. Next type of pain, a pain which uh, originates in the lower right part of your abdomen, and it is associated with vomiting, and when you press that area it is very painful on the right lower side. This kind of pain can be appendicitis, it can be appendix, inflamed appendix. Next type of pain, a pain which is persistent, which has been going on for a long time, and it is in your right upper part of your stomach, of your abdomen, and it happens occasionally, but it has been going on for a long time. This can be pointing to a gallstone. So this might be a cholecystitis or an inflammation of gallbladder. Next type of pain, a pain which is associated with vomiting and occurs when you take a meal, and you're not able to take a meal because there's a lot of vomiting, and there's distension of your stomach. Your stomach bulges out whenever you take a meal, and the pain is persistent, has been for few weeks, or let's say a month. So this kind of pain can be due to intestinal obstruction. So these are the common kinds of pain which you experience. Next common type of pain occurs when your empty stomach, and then you are having a pain, and immediately when you intake food the pain goes away, or there is pain immediately when you take a diet. So this kind of pain can be due to peptic or duodenal ulcers or gastric ulcers. So these are some of the common types of pain which you should be aware of. So all these kinds of pain have their specific diseases, those that I just explained. But in all the above mentioned pains which I explained, you should go for an abdominal ultrasound. You should get an ultrasound done, because ultrasound can pick up all these conditions which I just mentioned: pancreatitis, gallstones, appendix, kidney stones, ureteric stones. All these conditions can be picked up by ultrasound. So an ultrasound is a must in any case of abdominal pain, and in many cases you are having abdominal pain, you go for an ultrasound, and it might be normal also, because as I just said at the beginning of the video, not all kinds of abdominal pain are due to diseases. So if you go for an ultrasound, it might come out to be normal also. But in any case, you must get an abdominal ultrasound done if you are having pain. And even if you are not having any pain, I strongly recommend an annual ultrasound routine checkup, because it is very important. There are a lot of organs in the stomach, in your abdomen, there are a lot of organs, and ultrasound is a very good modality, and ultrasound is a very good test to reliably rule out, reliably detect most of the serious diseases these organs can have. So I strongly recommend an abdominal ultrasound annually done, so that you can save yourselves from serious consequences of the diseases which can affect these organs. I hope you get a lot of information from this video, and I hope you follow what I said, because it will help you to save yourselves from serious diseases which we commonly detect in our routine practice. And I strongly feel if every person goes an annual screening ultrasound, we can really save a lot of patients. Thank you for listening.